She was so active. She was very athletic. I mean, she's constantly going.
I was 9 years old. I can remember that morning. It felt like, any summer day as a kid. And I was actually being babysat by two boys. We wanted to have popsicles, and I had ran to the refrigerator to get a red one because those were my favorite. They wouldn't let me have one, and I had to have a purple one. Later on, I went back and I snuck a red one. One of the boys said, we should just shoot her so that we don't have to worry about her taking our popsicles. It was just something that he said. Like, he was a 13-year-old boy that was just kind of making a joke. And so the young boy went behind me, had picked up a .22 rifle, pointed it at me thinking that the clip was out of it. But pointing at it with a bullet in the chamber, a bullet came out, hit the back of my neck, it severed into fragments and severed my spinal cord.
I just remember losing my mind or going blank because I gotta get where she's at so I can be there to help her.
I was gonna be paralyzed for the rest of my life and not really knowing what that really meant. From 9 until 21, I was in the hospital a lot. Things just kind of kept piling and getting more complex.
She got down to around 58 pounds. I knew that if we didn't do something for her chronic pain, that we were probably going to lose her.
I said to myself, if this is my time, this is my time. And those moments were there, and they were true, and they were deep, and they were real. But I'm going to be back in the hospital if I didn't make a change. And so with my sister, being a yoga instructor, she's the one that really approached me and my mom and my doctor about the integrative therapies that I use so much today and is the foundation of the Chanda Plan. If we're not living life to the fullest because we're constantly every day fighting the battles of the symptoms of having a long-term disability. So that was really what sparked the idea of the foundation, is because I wanted to raise money so disability and wellness could truly coexist. The services that we provide through the Chanda Plan Foundation are therapies such as acupuncture, massage, chiropractic, adaptive yoga, adaptive exercise, and we specifically focus on individuals with spinal cord injuries, brain injury, muscular dystrophy, cerebral palsy, and other disabilities as well.
We forget about people with disabilities and what they're able to actually do. To support the Chanda Plan, that's going to help all of those people with disabilities feel better about themselves, be able to go out and do some of the things that they didn't think they would ever be able to do.
It's really crazy to think that we've been around for 10 years. It's such a huge accomplishment. As soon as people start to hear about us and know about us, we just keep growing. So really excited about the new facility. We're adding chiropractic, nutrition, mental health, and primary care physician. I see somebody coming out of acupuncture and crying because she has no pain, from somebody that was in a power chair that is walking again. That's what keeps me going, and those are the pieces of my work that I love.